You're all very welcome. People may come and go during the course of the evening, which is absolutely fine, but I'm going to pass you over to my colleague Eileen O'Leary, who is the head of inspections and assessment, who will take you through the rest of the evening. Eileen, are you there?
I am. Can you hear me, Grant?
Perfect. Yeah.
Can?
I'll mute myself now.
Great. Okay. Thanks very much, Grant. And good evening, everybody. You're all very, very welcome, as Grant said, to this, our second of our spring series, webinar series. Grant has introduced me. My name is Eileen O'Leary, and along with my colleagues, Elaine Murphy and Breda Clooney, we're responsible for the national management of the 8 regional inspector teams that I suppose you're very, very familiar with as they go in and out of your businesses over the course of their 3-year registration. You'll meet Breda and Elaine as we go through the evening, and we look forward to your questions. And this is going to be very much an interactive session. We'll take 2 presentations and then we'll take some questions, and then our other 2 colleagues, Mary and Stella, will speak to you about our learnings and our resources. But the overall purpose of the evening really is to explain to you how we revised our inspection process over the last 12 months to share the learnings that the inspector team have gathered. And we've all been learning as we've gone through the last 12 months. And we hope to share that with you so that it might leave you this evening with some ideas of how to better improve your infection control measures and the way you're grappling, I suppose, with COVID-19 and the way we're all working in this highly unusual situation. We appreciate the inspectorate, what an extraordinary difficult time this has been for you in the front line of the state's childcare provision. It's been in many ways a long and winding road. Nobody would have guessed last March. We all thought it was a couple of weeks, maybe a couple of months, but we're in a very different place now, and we've received very many different advices over the last 12 months, and those have given you plenty of challenges, both individually and as a business. And our inspectors are very much aware of that when they go out to inspect in your businesses at what is, as I said, an extraordinarily difficult time. This evening, we'll share our key learnings, and we've worked very, very closely with our colleagues in the Department of Public Health and HSE, and so we'll bring those learnings to you as well, so that it might help you as you go about trying to deal with COVID-19 in your business and continue on this journey. The news, I suppose, over the last couple of days, we acknowledge is particularly difficult. We all thought we were kind of getting out of it, and we don't really know where we're going until, I suppose, we see what will emerge over in the next week or so, and see what the government gives us in terms of a plan. So we appreciate that we're not there yet, and I suppose we have to continue to monitor how we carry out our inspections as the pandemic continues to progress towards the summer. Just to give you a little bit of context, I suppose, in terms of the early years sector as a whole, we have almost 4,500 services registered with us here in Tusla. And by the end or by the middle of March, we've almost 640 services that have notified Tusla of a COVID-19 in their service. So it's affected 640 of our services nationally. And each one of those notifications has brought with it for you an incredible amount of stress and difficulty. And during those instances, our inspectors have worked with you and with our colleagues in public health on all of those notifications. Every single one of them, every single business that has had a notification has notified us. We have been in contact with, and I hope they've worked with you through what has been a very difficult time. Obviously, we have a job to do about protecting children and protecting the services, but at the same time, we do so in very cognizant of the stresses that you're under. And our inspectors have seen firsthand the stress and anxiety that has occurred in your businesses during these times. So we continue to keep that in mind as we go about what is our regulatory function and what is our job to do. COVID-19, I suppose, presents a unique challenge because if you can do everything right, it can still go wrong in your service, and we're very much aware of that. I suppose, nevertheless, over the last 12 months, we have learned what things do work, and we have seen really good practices and services and really good ways to mitigate the risks that COVID-19 brings into your lives. And so we'll discuss these measures with you and hopefully give you some, I suppose, top tips as we progress through the evening. So this evening, I suppose it's a bit of a team effort. We have 4 presentations. I'll start kind of setting the scene, giving you some introduction as to why we carry out inspections. And a lot of people have asked us over the last 12 months, do you really need to come into my business at such a difficult time? And many people have asked that question. I suppose just want to give you the regulatory context and why we have a job to do, and explain that to you just to set the scene a little bit. Elaine then is going to talk to you a little bit about how we've revised our inspection methodology to keep the children and your staff safe and also our own team safe. particularly in difficult times and after Christmas. And Mary then will take you through. Mary's one of our frontline inspectors and has worked with many businesses firsthand over the last 12 months in the Dublin area. And she'll take you through our key findings and the best practices that she's evidenced, particularly in some of the very larger outbreaks. Stella then is one of our inspection registration managers, and Stella is going to talk to you about the resources and supports that we have available to help you and that have been available since the summer of last year. And she's done a great job overseeing our advice line that many of you have contacted to get support for your service. So those supports are still available, and Stella will take you through those this evening. So as Grant has said, if you have questions, we'll take them in the chat box, and I'll stop after Elaine's presentation to take some questions, and then we'll stop also after Stella's presentation, after Mary and Stella do their talk. Okay, so I suppose the question then, why are we inspecting early years services, and particularly at this very, very difficult time? And I suppose it's important just to say to you that the primary objective of any regulatory inspection system is to raise standards and to improve compliance. And it really doesn't matter whether you're regulating childcare services or pharmaceutical services or hospital services. All regulators try to strive, because that's our role, to achieve this outcome of improving standards and raising compliances. But I suppose for the childcare sector, you know, what's important to note is families and the state need quality childcare. So it's our job then to make sure that there is quality childcare available for families. And the state needs independent assurance that there is quality childcare, because failures in childcare is not accepted by society or is not acceptable by government, and even small failures are not accepted. And we've seen that when we've had small failures in childcare and significant failures in childcare over the last, say, 20 years. On a more global sense, I suppose we regulate because the state and the economy needs quality childcare. And for an economy to function, we saw last year when childcare stopped, that, you know, the economy was crying out for childcare to be reopened. So the state needs quality childcare and the economy needs quality childcare. So many of you are here this evening are in very compliant businesses. And I suppose that's very often what happens when you put on these, you get the most compliant people coming to these types of webinars. So you need a regulatory system, because a regulatory system gives those compliant businesses a level playing field. So any business that tries to cut corners or doesn't comply with regulations, I suppose the idea of a strong regulator is it rules that out and we take appropriate enforcement action. So they're the kind of the reasons why we have an inspection service looking at early years services in Ireland. And like sometimes I suppose when people say, can you stop or whatever, I suppose you just think back on these, like that these are our functions, and it's the functioning for helping families and children, and also functioning for the economy as well. So, and then because the state, I suppose, because regulation is so important to families and the state, the government then puts laws in place and they require agencies like Tusla to carry out inspections. So it is our job as a statutory and it is our statutory obligation to carry out inspections in your service. And the regulations and the Act says that the agency shall cause to be visited from time to time or prescribed early years services in order to ensure that the person carrying out the service is complying with this part. So that's our function. Under law, we're mandated to carry out these inspections. And it also mentions it in the regulations made under the Act. It talks about that we shall the inspection will be carried out by an authorised person, and that we will issue reports on foot of these inspections, and then where necessary, we can enforce the regulations. So that's our legal responsibility under law as an independent state agency. Tusla is mandated to carry out these inspections and to enforce the law where necessary. But you also have a legal responsibility, and I suppose it's important to reiterate that. As a regulator, we have to say to you that it is your job as the person who's in charge of an early years service to take all reasonable measures to safeguard the health, safety and welfare of children attending your services. And that's set down in law, so that is your legal responsibility. And I suppose in many ways, putting that in, I suppose in kind of plain English, what we're saying is it's important that your services, they're safe and happy places for children to play, learn and develop, and it's all day, every day. You know, we often hear when our inspectors go out and someone says to them, I put this in place for you, or I fixed this for you, you know, they say to the inspector, well, it's not for the inspector you're doing it for the children, and you're doing it to comply with the laws. So I suppose they're the kind of messages we'd like you to remember as you go home this evening, that you're doing this for the children that attend your services, but also to comply with the laws of the land. So we all have, I suppose, a collective responsibility in terms of our legislation, and that's, I suppose, if we can work together, we'll do that more effectively, and that's what this evening is about. It's about us telling you how we do our role, and explain to you how you might use some of the learnings that we've learned over the last 12 months in your role as you try and prevent COVID-19 in your service. So that's from me. Thank you very much for listening. I'm going to hand you over to Elaine Murphy, and Elaine is going to give you a run through what we did, I suppose, when services were about to reopen last year, in terms of revising our inspection methodology to make sure that we put an increased focus on safety, on infection control, and also then about how we changed our inspection process to make it safer for our team and to make it safer, more importantly, for the children and your staff and your services. So I'm going to hand you over to Elaine. Elaine, can you see if you're online?
Yeah,
okay.
That's great. Thanks very much, Eileen. That's great. Thanks very much. Yes, it's good to get an opportunity to speak to you all today. Just again, my own name there is Elaine Murphy, and today I suppose I'm just going to go through with you what to expect from an inspection during COVID-19. Very much, I suppose, back in March and 2020 there, we were in a position where we were required to relook at our inspection methodology in light of COVID, and very much, as Eileen has stated there, with the premise in terms of keeping everyone safe, in terms of children, staff, and obviously our own inspectorate staff as well. So very much, I suppose, it was that revised methodology which you have grown to learn now over the past year in relation to how you have been inspected. So again, that public health guidance is key to everything that we do. So I suppose what has changed really, that we've gone from more the unannounced on-site inspection to really a hybrid model of a documentation request, which is very much the remote part of the inspection, and then the on-site announced inspection. So I'll go through, I suppose, what to expect from your point of view. Step one, I suppose, really is very much the phone or email contact by the early years inspector to you, and the first initial communication is to chat about the inspection, what's going to take place, obviously, and really look for the first documents in relation to the pre-inspection documentation request. Now, you'll all be familiar with this, and I suppose part of that documentation request is looking for your policies and procedures, your risk management policy, your incident plan, also looking at the procedure for hand washing, your drop-off and collection procedure, and obviously as well those enhanced measures now for cleaning and infection control. So you're all very familiar with this at this point, and I suppose on our side here, very much in the early years inspectorate, we have new generic emails that can take a lot of documentation. And I suppose with agreement as well with your early years inspector, you obviously have the opportunity to have that documentation ready on site and agreed then that it can be viewed on site by the inspector. So that moves us then to step two, which is very much the early years inspector will review your initial submissions, liaise with you, link in with you if you're having difficulties with some of the policies, procedures, and to assist you in relation to, I know again, there's a self-assessment checklist. So all of those documents in relation to what you have to have for your inspection. I suppose then we're moving to step three, which is the on-site inspection, and that is very much announced. And obviously in keeping with public health guidance, again, strict physical distancing, the appropriate PPE is worn, and obviously hand hygiene, respiratory etiquette, all to the fore on the on-site inspection. I suppose it is important to note if an inspector arrives at a provider's premises and there is a notification of COVID on site, the inspection will not take place. So that is just to give people, I know there had been a question in relation to that too. Again, once the inspection is completed, a feedback meeting will take place remotely or on site if agreed by both parties. I know again, to be fair, a lot of you have expanded your outdoor areas and this has facilitated outdoor feedback meetings, but again, it can be done remotely and it's been done very successfully remotely. Step four then, moving on to our normal procedure then, when the early years inspector will draft the inspection report and issue to you with the factual accuracy, and if there is a CAPA to be sent on, that can all be done digitally, and it's been very successful to date. So I suppose then just moving to the next slide there in relation to, I suppose, our increased focus there on the new inspection methodology and what we're looking at. Again, always to the forefront of our mind, the health and safety controls of all of you, of our children, of staff, of the inspectorate. And I suppose just to give you a little bit more detail in relation to that of our inspectors, they have been provided with FFP2 masks, which are a high-grade mask in relation to provision of the inspectors and obviously the providers, because I suppose we are aware in terms of the droplet transmission of COVID. So again, these are a high-grade mask for that. In terms of physical distancing, obviously to be maintained at all times, and hand washing and respiratory etiquette. And again, we're coming back to the basics all the time, then do the basics well. And the hand washing and respiratory etiquette. Again, which has been proven very successful, the introduction of remote desktop review of documentation. I suppose I just see a question flying in there from the side that people might have had difficulties. I suppose we have initiated a new generic email for all of our 8 region and areas that really has no limit on the amount of documents or the size. So there's quite large areas now, so you shouldn't have that problem. So if you do, you can certainly ask your inspector for the generic email for the particular area, and you can send in your documents, because we have provided that with very specific reference to enable you to send in your documentation. So again, the remote part, which is really the on-site inspection, the remote part is done there, and then we move on to the on-site, but being very particular in relation to reducing our time on site of the inspection, and obviously looking at the sampling of documentation. I do appreciate that there might be high numbers of staff and turnover, so when you're looking at Reg 9 there, we'll do a sampling of the documentation. Again, coming to the next area of the closeout meeting, as I said before, they've really proven very successful outdoor or again remote where possible. So we are moving to that hybrid model, and I suppose we are taking the positives and taking your feedback on it, that, you know, going into the future as well, to maintain that remote element of it as well is proving quite useful for providers, and we would, you know, we'd welcome further feedback on that. Moving to the enforcement side of the inspection, we have had digital regulatory compliance meetings and regulatory enforcement meetings. And again, obviously this is the enforcement side of the inspectorate, and we have had those digitally and have proven very successful. As I say, we want to move people to compliance and to raise the level of compliance. Just chatting then about the regulations again, because I know some queries had come in. Obviously, we are doing a reduced amount of regulations at the time of on-site inspection or during COVID. So again, it was looking at a selection really of regulations that were going to give us a good and thorough inspection at the same time. So very much again, under management and recruitment, we were looking at 9.2 and 9.7, which is very much the new staff and updated policies, training and supervision. Regulation 10, looking at your policies and procedures, and as I mentioned earlier, ranging from risk management to infection control to your incident plan. Then Regulation 11, looking at the staffing levels, and I suppose again, they're around the ratios or adequate number of adults working with children. And then obviously moving to 19, and I know particularly as well, this can, you know, be an area where services shine, you know, in terms of being inspected. And again, as I said, we are trying to have an inspection that's going to show those good parts or show that valuable work and that those supporting relationships that are so valuable within this setting. And I suppose, again, the physical and material environment, how that has changed as well. And really, you know, you have adapted so well to that by how you have used your physical and material environment for children in terms of rotation of toys, increasing your outdoor space. So it is really well noted in terms of that, your flexibility around that in relation to Regulation 19. And again, moving on, the last regulation there, 23, in relation to safeguarding health, safety and welfare of the child. So obviously focusing on infection control, on overall general safety and safe sleep. So they're the main regulations. Now, again, apart from that, just moving on, obviously we do reserve the right, and as mentioned by Eileen earlier, it's part of the core of our regulatory function, that we have the right to look at other regulations or carry out bespoke inspections, or indeed amend inspections on the day. Obviously, if something comes across on the day under maybe Regulation 29 premises, that really we might have to provide an assessment on the day. So again, as you're all aware, information can be received or issues can be identified on site on the day. And again, we appreciate that issues that can be identified can be rectified on the day and some may not. Obviously, any significant risk or identified risk to a child is of huge import to us. So we really have to obviously amend the inspection to reflect that also under the regulation that it may be applied to. And again, I suppose in terms of inspections, obviously the service has a history of inspections, so we have to be cognizant of previous non-compliances or anything that wasn't addressed via CAPA or closed out. And you will note that that would be on your inspections and noted that it might be followed up on follow-up inspections. So that's always a caveat that can be added to a report. And finally, in relation to that bespoke inspection, again, we may have received feedback and concerns. This was previously referred to as unsolicited information. But again, if we have feedback or concerns that we have to act on, that will all be done on the day of inspection. So while we do have a pared down version of our regular inspection model that we would use, obviously we can select bespoke regulations to inspect on the day also. And again, I suppose looking at our inspection process, we want to be transparent and open with you at all times. And very much, I suppose, in light of that, all of the documentation that I've spoken on is available on our website. You've got and again, I suppose a lot of you as well, and Stella will talk about it later, the support's available to you on the First Five, which is an excellent website, and all our documents are accessible there too. So it is very much the inspection protocol for registered providers. So that brings you through really what you need to do and is very much a key guide for you as a registered provider to look at. The second one very much relates to our toolkit, which are tool that we use on site that you'd be familiar with. So it brings you through everything that we look at or everything we're going to ask about. And the third one there is very much the pre-inspection documentation request. And that's what I spoke about earlier in relation to the initial phone call or contact that's being made with the inspector with you to request the documentation. So again, I suppose it's just to thank you for your participation in terms of with all of these inspections to date. We know it has been difficult and it is constantly in flux. But again, as I said, our inspections are consistently and constantly under review, and we appreciate your feedback on those as well. All right, thank you.
Thanks, Elaine. That's very useful. I hope everyone found that informative. If you haven't had a recent inspection, now you know what to inspect. And if you have had one, hopefully you found it not overly stressful. So Grant, I can't see because I'm hosting the presentations. If there are questions in, you might want to give us a couple of them there.
I can just see one at this stage, Eileen, and that's from Alec, and it's sort of a technical question. I always have problems transmitting files such as large documents and photos to Tusla as part of the CAPA process, and then can Tusla improve how they receive email attachments?
Yeah, we had this issue and during last year, and particularly when we went remote. So we did resolve it, as Elaine has said. Elaine, you want to give the overview there?
Yeah, sure.
Generic
yeah,
email
no problem. Yeah, we did absolutely. Yeah, absolutely. This was highlighted as a significant problem because obviously in terms of registered providers sending in documentation or photos post CAPA. So all of the 8 areas have a generic email and there's no limit on the amount that can be sent in. So to be fair, if you are having a difficulty, please contact your inspector and they will provide you with the generic email. So we have 8 of them for all of the 8 areas. So you should be able to send in anything you want. Yeah.
Cloud-based technology, so it should be fine. We'll include them with the posting on the website with the details of this webinar as well, Grant. So that's fine. Okay, so we're getting away lightly there, Elaine. I think.
That's so okay. We'll take it. Yeah.
We'll take it. We'll take it. Yeah. Okay. Great. Thanks, everyone. If there are no further questions, I'm going to hand you over. Hold on. Now, a couple of late ones there, Grant. Have you any advice re fire evacuations during COVID? I might hand that one over to you, Elaine, there, or Mary. Maybe Mary could address it. I suppose just one thing we have come across, and I think it's going to crop up, is people are using fire exits differently during COVID.
Yes.
And we have had a number of cases of very unfortunate cases of children going missing during COVID from services because of the use of fire exits. for you know, to keep a one-way system through a service. So that's been something that we are trying to flag with services now to try and resolve that, so that if you are using fire exits in your one-way systems, that you make sure that there's appropriate supervision so that no children go missing. But anything else on fire evacuations that has come up? Elaine, are you familiar with any other issues that have arisen around fire evacuations?
No, I suppose it was very much, again, that you have to have your plan in place for fire evacuation, and very much what Eileen was saying there as well, because fire exit now are previously being used for different uses for the a one-way system in relation to that. So to ensure that you have the appropriate fire, and to continue those throughout COVID. So I think, again, that you really need to have that plan in place in terms of that for your service. Yeah.
Yeah, you can't, you know, eliminate one risk and create another, I suppose, is the message. Then there's another question here. Can there be a set time frame which the inspection will happen after request for documents? Some services are waiting ages. I'm going to pull Breda in here as well. Breda's our other lead manager who works very closely with Elaine and myself. Breda, around the time frames for inspections.
You're muted there, Breda.
I suppose we don't have a specific set time frame, and that can vary for different reasons. It can happen as short as a week, 10 days, to even longer. So because we have inspectors that may be grounded for whatever reason and can't continue to inspect, they might have opened inspections, and before they're back out again, that may take some time. So it can vary from a week to month or even 2 months. So we're encouraging inspectors who can't get out on site at the moment because they've been close contacts, but yet are working remotely at home, to open up inspections that they will inspect in the future. So I know some of you that they may have been contacted in regard to an inspection. You might think you're getting an inspection within a week, but it could actually be multiple weeks. So it varies. There's no quick answer to it, and there's no quick time frame to it. It can vary from week to 6 weeks, 8 weeks, really.
Yeah. We have a question as well around the same issue, that they had a document sent in December and they're still waiting for an inspection. But I'm glad to see somebody is looking forward to an inspection. So that's great. People see them in a positive light. And
some might have sent in documentation where they've had COVID in a service, and they would be requested documents and submitted them. And upon assessment of the documents, a decision may have been made not to inspect the service. So unless you were specifically told you were going to get an inspection, that's where the documentation is requested, because we're planning an inspection. There's other situations where documentation is requested if you've had a positive COVID case in your service, and we're doing support in terms of review and documentation in those cases. Just to go back on one of the questions there around fire evacuation, again, it's another difficult thing to manage in a service when you're trying to evacuate a service and keep children at distance, and keep, I suppose the main thing is to try as far as possible and reasonable to keep your pods intact. So you're doing an evacuation, you try and keep your pods together. There'll be more talk later in the night about pods, and as far as reasonable to try and keep the pods intact and limit the spread if it comes into your service, to limit the spread within the service.
Yeah, and somebody has just made that point, Breda, that fire drills are proving very difficult due to social distancing. So
yeah, and I think in the interim for fire drills, if it's not a real fire, I think there is flexibility around how you operate those fire drills to keep children safe, and maybe do pod evacuations, or you need to look at that within your service. And if you have a rationale for doing that, I think in times of COVID that we are in right now, there is a rationale for doing a pod evacuation rather than a full service evacuation, and putting children and staff at risk at these times.
That's a good point. Yeah. Okay, some nice compliments there on some positive feedback for our inspectorate. So we'll be sharing that with the wider inspectorate during the week, which is great. So thank you very much for that. We appreciate that, Fiona, as well. Okay, so maybe will we move on then to our next presentation. And I'm delighted to welcome Mary Redmond. Mary is one of our Dublin inspectors, and I suppose in many ways Dublin has been at the front line of the COVID-19, particularly since December, with the numbers of outbreaks, and that's been particularly challenging for you, those people who are joining us from around the Dublin region. So Mary's had a lot of experience with dealing with a lot of very stressed people, and I suppose you've seen the really good practices as well, Mary, that have been put in place. So I'll share the screen. Mary, you need to come off mute. So thank you, Mary, for joining us this evening, and we look forward to your presentation.
Okay, thank you very much, Eileen. Mary Redmond is my name. I'm an early years inspector in Dublin South, but it's quite possible you've seen me in services in Kildare and Wicklow as well at different times, but not recently. I suppose the first thing I'd like to do, just tonight we're going to talk about like really positives identified during inspections since the services reopened last year. Um, I suppose I'd like to acknowledge the fact that when services did reopen, I was involved in the helpline as well, and like the enthusiasm of providers to actually do the right thing was actually it was very, I was very positive. I thought this is actually going to go quite well. And then when we did actually get into services in kind of August and September, the lovely thing about going into services was how it was such a normal environment for children and adults. Everybody was, it was like they were back in kind of January, February. And I suppose because they were, working together without masks, it was strange to go into places. I was the only one wearing a mask at that time. I know the messaging around masks has changed since, but we'll talk about that later. But I suppose the big thing that and I'm not just talking about myself and my experience. I mean, I would have consulted a lot with colleagues and, other teams about the consistent message of hand hygiene and respiratory etiquette. It definitely was improved in services. I mean, it was aided by different things, visual aids and cues for children, which probably were always there. But I think there was definitely the public health messages were definitely being reinforced in services when we went back in August and September. And, we know that there'll be long-term benefits of enhanced infection control in services, and a lot of services would have reported, much lesser incidence of other infections that they would have seen over like hand, foot and mouth, and diarrhea and vomiting and impetigo and them kind of contagious infections that they would have seen a lot of, especially over the winter months, and that they were practically eliminated this winter, which was good. The other thing we did see is a lot of maximization of outdoor play. Definitely when we went back in August, September, October, it was, and a lot of providers had used, funding, I think, to enhance their outdoor areas. So they were sheltered. So they were sheltering from some of the sun early on, and then from more inclement weather as the year went on. But it was definitely noticeable in most services. I mean, we have to acknowledge there are still some services that don't have outdoor areas because they were sessional services that registered prior to 2016. So, but luckily for them kids, I suppose they're in the service for a short period of time. Another positive that we noticed was additional staffing in services. Now, I suppose I'm talking more as well about big full daycare, full daycare services more. And I acknowledge that I know there's providers from full daycare and sessional services on, and there is a difference in staffing. But the additional staffing, say for example, and I did a lot of when I went into services asking them about what did you find the easiest thing or the most difficult thing about coming back to work, and a lot of the in the rooms they were saying things like, well, it's great we've an extra person because the idea of the pods, and so it was less stressful in terms of the actual day-to-day work. And that they, staff definitely said, say, for example, for nappy changing, where they might have had two staff in a room, now they had three, another person wasn't coming in. So sometimes children would get upset when it was a different person, just relieving or whatever. And that and they found that, that it made their job less stressful. And that's the consistency of staffing. It was positive for Regulation 19 and as well for Regulation 23. It's easier to supervise children when there's more of you there. And when I'm talking about over and above the minimum adult-child ratio, which in fairness we usually do see in services. There was also an additional focus on training of staff, and I suppose for a lot of staff who'd been in services for a long time and maybe might have had kind of training, ad hoc training, shall we say, like staff who maybe hadn't had training for a while had training, specifically in enhanced infection control training, and that was very evident in services. So that was all good. I suppose the infection control, then the pods thing, that was, you know, a concept that came, you know, to see how you would minimize the mixing of staff and children when you reopened to, you know, mitigate against the spread of COVID in services. It was one of the biggest questions we got asked on the helpline. And I suppose that's been kind of a learning for services, just managing that. And, you know, I suppose as inspectors going in, we can't tell you exactly what to do. I suppose we can point out the risks and just say that if you're operating a pod or pods in a certain way, you know, you're either minimizing the risk of the spread of COVID in your service, or you're increasing the risk that if there is an outbreak, it's going to have a bigger impact in your service. So, like, we do acknowledge, and I would have seen a lot of even changing ideas about how pods are managed since you have reopened. And I suppose then the difficulty of bringing school-age children into the service who have been in a school. That happened in September. There was a lot of talk about that. How are we going to manage it? Because the children were back, the school-age children may have been back in the service, and then that was fine because they had their own pod in the service, but now they were going to be going to school in September and then coming back to the service, and maybe mixing in different schools, and, you know, so how you were going to manage that. And I suppose, like, what my advice always to providers is that, you know, at the end of the day, the providers have you've the responsibility to assess and manage the risk, and, you know, we can only advise you about, you know, probably the best way to do that. I know I have that. I always I'm not sure why I have to what you haven't do it well there. That's just in general around, I suppose people sometimes were doing more than they needed to do, like, so they were kind of going over and above what they needed to do in terms of you know, pods where it would have been possible, maybe dividing a room where it would have been okay to keep that room together, because, you know, they said, oh, we thought we had to divide a room, but you're saying, well, you know, like, you understand that there could be 15 children as opposed to 7 or 8 that would have to be excluded from the service. But, you know, like, really how you were going to manage breaks and stuff if you were having 2 different staff in 2 different pods in the one room. And, you know, people went, oh yeah, like, when you talked it through, they understood that. So the pods, that is a word that, you know, we've all come to love and hate over the last 6 or 8 months. But I think it's as time has gone on, it's definitely management of them is getting better. So then, of course, like, I suppose the infection control, the hygiene measures that we'd see in services, that I suppose the ones that haven't improved the same way as hand hygiene and respiratory etiquette and stuff, that would be the nappy change, and it's very good in some, but there are things like, you know, the actual steps and procedures sometimes just haven't been as I suppose it's just difficult. And I suppose the introduction of extra PPE as well, because some services, some staff would be wearing extra PPE all day, so they're wearing an apron all day, and then they're changing a nappy, and I think sometimes they forget they have the apron on. And, you know, that's where I'm talking about, when you're doing something, do what you have to do and do well. It's not necessary maybe to wear an apron all day in the service. You only have to wear it for nappy changing. One of the biggest things that staff said to me was cleaning schedules. When they came back, and I'd say, what's the hard? They'd say the cleaning, the constant cleaning. That was the most stressful thing. I thought they'd say, oh, I was afraid of coming back. I was afraid I'd catch COVID. I thought, you know, but actually they were saying the most difficult thing was the cleaning and you know, like, and the constant cleaning, I suppose. And I mean, you know, in fairness, services in general, cleaning schedules were ramped up a lot, and even in the outdoor area where you never had to clean, they were cleaning it. I suppose one thing we just remind services to do is that sometimes if you're using products, you know, there can be a build up, so it's important to have them deep cleans, you know, of indoor and outdoor areas kind of at weekends, to get rid of that residual kind of products on surfaces. I suppose the problem that, that we would have encountered a little bit was the cold water and wash hand basins, not so much running wash hand basins that were plumbed, but there was a lot of portable sinks introduced back when services reopened. And I suppose there was a difficulty because mostly that they can keep water hot for a certain time, but then they have to be refilled. And as well, they don't work that well if they don't have actual running water. A lot of them are pumped with a foot, and like I suppose my experience would be now a lot of services aren't using them. They were kind of a big fad when they reopened, but they realized if we can get a child to a proper plumbed sink with water, that's in their room, it doesn't have to be done on their way in, or whatever. I suppose the use of face cloths and baby wipes, which would have been a big practice in services, that to clean children's hands, so children's hands were physically clean, but with COVID we said, well, you must actually wash children's hands under running water with soap, or else it's not effective for infection control, or use hand sanitizer. But I suppose it's more appropriate to use running water and soap for children's hands. And I suppose particularly for children are good at washing their hands. I suppose it's with the babies and younger children that I suppose there is difficulty, getting them to a sink and holding them at a sink, and how you manage that. So I mean, I suppose that would have been a little of a difficulty that we would have seen services had, to say, well, it is difficult to wash 10 babies' hands and we have to hold them and they have to be carried to the sink. And but services have been very innovative there, and like a lot of services have actually put in a lot of extra plumbed hand basins into baby rooms, for example, to make that easier for staff. I suppose the other thing is an effective system for sterilising mouthing toys and managing drinking utensils. I suppose pre-COVID, we never liked to see children sharing cups, but like say in a wobbler room and that, but sometimes, you can't help but one grabs it. But I suppose just in this era of COVID, it's just that little bit more, there's more of a risk that, a highly transmissible COVID is in the room than maybe there would have been of an outbreak of maybe some gastrointestinal outbreak in previous time. You never want to see it happening, but I suppose we're just a little bit more conscious of it. I know it's more difficult to manage because you want children obviously to have access to water, but then we're kind of going, children can't have access to someone else's water. But that's they're just small things that kind of come up on, and I'm sure inspectors like individually discuss that with services when it comes up. Children from different rooms sharing the same sleep space. This, kind of came up just in terms of, sometimes sleep rooms, they're tight enough anyway. And then when, the public health guidance was that if children from different pods were sharing a sleep space, they should have been 2 meters apart. So how services managed that sometimes, that they did have a difficulty with that, because sometimes then they had to take children out of a sleep room that had access to it. And I suppose how they managed that, on an individual basis was difficult, but it was something that was, as time went on, they may have changed what they decided to do. So may have merged to, kind of said, well, look, we'll keep them 2 rooms as a pod, and then the children could share the sleep room. Serving food directly onto the table, like this has always been a problem in terms of cross contamination, but again with COVID, the way that we know that it definitely stays on hard surfaces, well, serving food onto a table is never okay, but I suppose specifically it's something that we'd see hadn't really improved that much in some services, like, or maybe it had and then it started to slip as kind of time went on that we were inspecting. So yeah, the mask wearing, just, the messaging has changed over the 12 months on mask wearing for everyone, and particularly in services. I suppose definitely when we went back in July, it was that if you were providing direct care to children in a room, the staff or children didn't have to wear a mask. And I suppose I would have seen a lot that, in general, staff weren't wearing masks in rooms, which was, perfectly acceptable going along. And there, I mean, so a lot of providers actually gave, well, my experience was they gave staff the choice. So staff had a choice. If they wanted to wear a mask, they could. But that tended to be the minority were wearing masks. Now the message is more that really all staff should wear a mask and remove, when they think it's necessary, maybe if they're, if they're kind of intimately engaging with a child, and the staff, there is kind of some flexibility there for the staff around when they think it's appropriate. But that, there are times when they absolutely should be wearing masks in the service. And that's like, if they're undertaking paperwork or in a room, if they're circulating through the buildings at break time, or if they are talking to other staff in the room, that, they definitely should have a mask on then. So that's, I think, the key. I suppose it is, and it is difficult for, because the messages around mask wearing, especially in childcare services, I think has been, it's been changing and kind of all the time. So I hope that there is some, I think, new messaging going to be coming out, new from public health about more specific instruction or guidance about actually wearing masks in services. So that's the next slide, please. Yeah, I suppose these are the biggest things we would have seen in outbreaks, like especially for bigger services, staff moving between services, staff living and working together, which the provider may not have been aware that they were living and working together, and they may have then been coming into a service and working in different rooms, but the provider not aware that they actually were living together. And so I think especially over Christmas and since Christmas, the providers have realized, so they've made a big effort to put staff who are living together, they would be in the pods together. I suppose as well, just a little bit more about it. I see this in service as well. Sometimes, you're in the service and the manager comes in to me and she spends time in the room with me, and I'm kind of saying, if there's no need for you to be in the room, don't be in the room. And I don't need anyone in the room with me. And I try to keep my distance from the staff that are in the room. So I just to be a little bit more, I know there was an incident as well of where a cook was, the provider had made very specific instruction that the cook didn't go into the rooms when she was given the food, and that was fine. But as it turned out, when they did have an outbreak in the service, the cook had actually just gone into the room and kind of chatted to the staff member that was in the room, just, because they obviously worked together but didn't think, thought that'd be okay. So she was actually then deemed a close contact when there was an outbreak in that room, because her cumulative, she'd been in and out of the room having a little chat, and public health do their risk assessment, and it's a cumulative 15 minutes over the day. And so then the cook was out of the service, and that had an impact then. It was a big service. So just to be kind of conscious of things like that. Staff from different rooms having break together. While I to be honest, I don't think that's a problem anymore. I think it may have been, and just kind of not thinking about, or even they're in a room and they think they're social distance, but they kind of, the way it's hard when you. So I definitely, there's been an improvement in that since Christmas. That staff, that they're more aware that, and I've seen services where they actually have set up different rooms and corridor areas and stuff for staff, like say 2 staff from a room to sit together at break time or whatever. I suppose the big message around, and this would be like any of the outbreaks that I've managed in Dublin, it tends to have been symptomatic children or staff coming to the service. And again, parents reporting, oh, it's only a little cough. And, the staff kind of find it very hard to say, well, look, even if it's a little cough, you still have to keep them home. And, and then parents, kind of saying, well, no, he hasn't coughed today. So I think that the big message, and it's hard for providers, but especially it's something you can do with your own staff, and you're doing it with parents. But I mean, it is hard when people don't tell you the truth. But that has definitely been the biggest problem, is symptomatic children and staff. That's usually what has caused the problem in services that I'm in anyway. And the supervision of the exits, I suppose, Eileen alluded to it earlier. There have been a couple of incidents where, because of the revised, you know, using different areas for drop off and collection that you wouldn't normally use, and using exits that you wouldn't normally let parents in and out of, and parents, I suppose, you know, maybe not being aware that that's an exit and they have to close the gate behind them, and that they wouldn't know, you know, that's what's caused the problem. But I think, again, because there's been, you know, a couple of incidents, like we always say, we do learn from these incidents, and hopefully that's, you know, but it's difficult to manage. So the key learning, I suppose, is the importance of wearing a mask. That has been identified as a key factor in the transmission rate. Now, there's an example there of a student who wore the mask, but I was talking to a provider today, a big service. The person was symptomatic, tested positive, a worker, and there was 8 children and 2 other staff in that room, and they got the day 10 testing yesterday, and none of the other children or staff in that room tested positive. So, like, that's you know, the service was very disappointed that they had a COVID case in their service, and I was going, you know, that's not the problem. You know, the thing about, if a COVID case is in your service, it's how it's managed. And I said, that's success when you had one person symptomatic in your service and no one else in the service or even in the pod tested positive. Reviewing the living and working arrangements, to be honest, I think, you know, to be fair to providers, I think that's happened in recent times. Again, mentioning about the cooperation of staff and parents not attending if they're symptomatic. Yeah, the enhanced cleaning procedures, I suppose that'd be the one thing we would see, that there's a slight slipping in the cleaning procedures, and, you know, people were very on that when they came back. And I suppose when we came back initially in July and August and September, there were smaller numbers of children and staff in services, so I suppose there was more time to do them extra things, which is, you know, it's definitely more difficult for providers and staff now, with a lot of them operating almost at full capacity again. And yeah, so I suppose I hope, and I do think, that the hand washing practices will be maintained. I think they've been ingrained now, that you know, going forward it'll be it's going to make our jobs a little bit easier in terms of the hand washing anyway. And again, just that's my thing, do what you have to do and do it well. So, like, not overdoing things that you've been doing, in terms of, like, one example I'd have would be the temperature checks. You know, public health have said that that's not necessary, and you know, sometimes I just think it takes up extra time and it distracts staff as well. So just things like that. And extra PPE, just wear the PPE that you have to wear. Don't necessarily have to wear extra, because it takes extra time. And yeah, that's it. I think that's me done.
Great, Mary, thank you very much. Very, very informative. I suppose, and reiterate your first messages there, that, you know, there's been Trojan work done, and we're proud of our inspectorate for being out inspecting services, but we're also very proud of the services, you know, that they've taken on board a lot of the advice that's come from government and public health. First Five is a terrific website for people, and they've obviously, people have, you know, we're all learning. So so it's great to hear that we're seeing that on the ground as well. Do we want to take one or two questions, or maybe will we just, Stella doesn't have a long, I appreciate it's tough going for people, and we have a good few questions in, Grant, as I can see some of them here, but maybe we will do Stella's talk, and we'll hold some of the questions. Breda and Elaine can be looking at them as well, while Stella goes through resources. Stella, you're on mute, so I'll introduce Stella. Stella's our, thank you, Mary. Stella's our inspection registration manager in the Midlands region, so some of you might know Stella if you're in or around the Kildare, Wicklow, Meath General District, and I suppose, Stella, you've been in the Dublin North region as well in the past, so so you're very welcome this evening, and thanks, Stella. And I'll just flick up your presentation now, Stella, so and we'll keep going, and then we'll come to questions afterwards. Okay.
How are you all? Good evening, everybody. I'm going to bring you through the supports available to the childcare sector during this time of COVID. I've been operating or manning the helpline since the 3rd of June last year, so it's a year in operation now. Eileen, you can go on to the next slide there.
Sure, thanks, Stella.
Yeah. So really, the purpose of the helpline, it was set up to support and facilitate the safe reopening and operation of services during the COVID period. It provides a direct contact for registered providers and staff in the earlier sectors. And what we do is we take queries and concerns that come in, and we help bring you to the source of information to help answer your query. It has two purposes. It informs us of the main areas of concerns, and I think really important, it's a very good support to you as well when you're operating during this stressful time. Now, what the helpline is it's basically operated by 4 regulatory support officers. Margaret Monaghan covers the northwest and midwest of the country, and in fairness to Margaret, she's taken in a fair amount of the calls. Karina Cullen looks after Dublin South and Mid-Leinster, and Paula O'Keefe looks after the southeast and southwest, and Breda Hayes then looks after Dublin North and Dublin Northeast. The girls can be contacted either by telephone or email. So what happens is the calls come in to the staff manning the helpline, and they respond to queries, and occasionally they may have to escalate the query for decision making to the inspector for follow-up. They keep a log of all queries, which is great because then we know what's coming in, what type of queries. And like the girls manning the helpline, they make sure that all queries are responded to and closed out. If the queries are sent on to the earlier inspectors, they will respond to you directly. If the inspectors have any issues, they notify management of any significant matters that are causing a concern. And management, we provide oversight of any queries that come in, and we liaise with the inspectors just to ensure that there's a continuity of responses throughout the country. We keep up to date with the latest public health advice, which can change from time to time, and then we escalate matters where appropriate to the HSE or the DM or the Department of Children if there's any issues that are causing concern and that need to be addressed at that level. I'm going to give you a brief overview of the queries that have been received. Oh, sorry. Yeah, no.
Sorry, Stella, yeah. Jumping
Okay,
there.
So a brief overview of the queries that have come in. Absolutely. At the beginning, my gosh, we got so much about the pods, about the size, the formation and the mixing. And I think it's really important to realise that, a staff member who moves between a large number of pods can generate a huge amount of contacts. And like when there's an outbreak, this can definitely cause a problem. We've had a lot of queries about cleaning agents, fogging devices and steamers, and definitely I just checked today as well. We know that there's a lot that some services are using fogging machines, but the Department of Food, Agriculture and the Marine have not approved products for use within these machines for the control of COVID-19. What the research is saying is basically that they can cause irritation to the eyes, the respiratory system and skin irritations. The best source of cleaning, according to the Health Protection Surveillance Centre, is basically using clean, warm soapy water and getting into the crevices of toys with a brush. It's a simple mechanism, but it's the best mechanism to keep your equipment clean. Again, if you have an outbreak, that's a different situation, and the HPSC on the First Five website would have specific guidance on how you should clean if you have an outbreak. We've had a good few queries about equipments and toys, and again, it really is, say in sessional services that might have a morning and an afternoon session. Again, it's about the rotation of toys, keeping the toys keeping them separate for each pod. Sleeping again in services, particularly our full day services, a sleep room, it's absolutely fine to have 2 pods in a sleep room, but keep 2 meters of distance between the pods. We've had a huge amount of information, like there was a lot of queries around, the sanitary facilities, wash hand basins, the portable sinks. And again, just, warm water will encourage the children to wash their hands. Hand sanitizer, oh my gosh, at the beginning, definitely there was a huge amount of concern about hand sanitizers. Definitely, if concerned about the hand sanitizer that you're using, you can go on the Department of Food Agricultural website on government.ie, and literally they have a list of all the licensed hand sanitizers that can be used. Food and nutrition, basically with this now, it would be, our children allowed self-serve at meal times and the delivery of foods into services. Regarding the self-serving of food, sometimes children, if they're in their own pod and they've washed their hands, it's no problem to let the children give out give out the food from the fridge. because they're not going to come in direct contact. They're stored in containers. Transport, drop-off and collection caused a lot of concern as well. And on the First 5 website, there's really good tip sheets regarding that issue. Okay, next one, yep. Okay, travel. Okay, okay, travel, yes. Okay, travel basically is causing a lot of concern. Okay, obviously overseas travel is not recommended, but there are cases, and a lot of your staff are living, or maybe from different countries, or families might have to travel abroad for different reasons. And it's really important to keep up to date with the government.ie website. They have all the guidances there about quarantining, and there's different rules depending on what country the person has travelled to. So again, if you have any queries about that, it's really to look up that website. Face coverings, absolutely. As you can see now, that definitely face coverings are definitely they're definitely recommended during for the staff members in the service, but during intimate contact moments with children, so giving a baby a bottle or changing a nappy, their use is not recommended, because if a child was to touch the face covering at that stage, there'd be a risk of contamination. Ventilation is really important, and basically COVID, as we know, is a respiratory virus. And like they're saying now that opening the windows will help. If the COVID was in the environment, that it helps disperse the COVID and help in a way prevent it. So again, opening the windows provides an exchange of fresh air. Highly recommended. Other queries came about staff working two jobs, and in certain situations this can't be helped, because perhaps a staff member is working in a sessional service in the morning, and in order to make a living that they're working in a different service in the evening. But what's important here is that the staff member keeps a record. If they were to have God forbid, but they were to have COVID themselves, that they need to let the other service that they were working in know. We've had numerous queries about fees in the National Childcare Scheme, and again, the First 5 website is very good, because they have specific guidance there for that. Some of the queries that have come into the helpline have been in relation to unsolicited information or notifications of incidents of COVID, and what we've done in those cases is we've passed them on to the relevant departments in Tusla. Okay, then again, our own website, on the Tusla Early Years Inspectorate website, we would have our guidance documents in relation to COVID. And again, the guidance document initially was to help services prior to reopening, and then to assist you during the safe operation. Then there is the early years self-assessment checklist is there as well. And what this does, it ensures that the measures discussed in the guidance document, it helps you implement them in practice. And then we have the Tusla notification of COVID form. And I'd like to talk to you a little bit about that, and maybe give those of you that haven't filled any one of those in yet, maybe a few tips on that. So what with the notification of incident form, under the legislation, you're required to let us know within 3 working days if a case of COVID is detected in a child or adult in your service. So again, if it's really important to let us know if the case of COVID has been detected in a child or staff member. And if you've had to close a pod as well, that's very important. On the Tusla note, on that form, there's a summary of the notification. And here it's really, really important for you to give us some details. Don't give us names, but just you could say, a child had a COVID test on, say, Saturday, whatever date, that the test was taken. Then it's very, very important to let us know when the child last attended in the service. Okay, the actions taken by you, the registered provider, should be on this form as well. Have you informed public health? It's really important for you to let us know, have public health made contact with you? And if so, are they in the process of carrying out a risk assessment with you? And again, it's very useful to put on this form how many pods were affected, the number of staff and children deemed to be close contacts, and how many people are requiring the testing. What will happen is, when this form comes in, you will be contacted by one of our early years inspectorate teams. And they will ask you a few questions. Again, it depends how much details in the form is how much. The more details you provide us in the form, the less questions we have to ask you. But very much we're there to support you during this stressful time. And really, what the inspector might look for is they will look for, they might look for documentation requests, such as Elaine has explained earlier on. If you are asked for the all the documentation, but you're in the form of doing your risk assessment for public health, do your risk assessment for public health and then send us in the document. But don't be stressed about getting both done together. Do the risk assessment for public health first and then send us our information afterwards. The Tusla, the first 5 guidance during COVID-19 website is it's a go-to resource. It's really, really good. Everything you need to know regarding managing your service during this time is there. It's divided into 6 sections. There's an information session for parents, which is really useful for them. There's the guidance for yourselves, the providers. There's the regulatory guidance from ourselves, health guidance from the Department of Health, and then there's a childminding section and a practice support session. You've access to videos, webinars, information sheets, posters, tip sheets, and frequently asked questions support guides. This website also provides links to support organisations such as the City and Childcare Committees, your National Voluntary Childcare Organisations, Better Start, and the Irish Language Organisation. And I was in that website today and I noticed that in the practice support session, Barnardo's have put a tip sheet on teamworking. And given that a lot of your services are starting to operate a little bit to more capacity now, that's really useful because teamworking is difficult at the moment. All the staff are in their pods. They might feel quite isolated, but there's some very useful tips there. That's really all from my section.
Great, Stella, thank you very much. That's very useful. A small echo there. Sorry, maybe will you mute?
Yeah,
Stella,
I'll mute.
Thank you very much, Stella.
Absolutely. Yeah.
Great. Just a small conclusion slide then before we take the questions. I suppose we've said it during the course of the evening. It has not been an easy time for you. We appreciate the work that has been done. We're at crossroads, I suppose, really with these new variants. There is no time really to take the foot off the pedal. You're aware of that as much as we are. Your business model, I suppose, has been rocked to the core over the last 12 months. We appreciate that in terms of your funding, in terms of your staff and child ratios. And then organisationally, what you've had to do in terms of pods. So the inspectors is very much aware of that, and we do. While we have to do our job, we try and do it in as an easy way possible for you, so that we complement the work that you're doing on the ground to keep children and your staff safe. Essentially, I suppose if we were to wrap it up into a couple of take-home messages, the mask wearing is becoming really, really important. I spoke to one of the lead public health doctors yesterday evening following a very large outbreak in one part of the country, and she said, if you can just say mask wearing, it's becoming more and more important with these new variants. And I know that's not easy for services, and I know when you're looking after children that there is a change, but there will be more guidance on this over the next couple of days. Obviously, it won't always be appropriate to wear a mask, and we're not saying that because we have to balance the needs of children when you're caring for them all day long, every day, with their verbal needs and everything else. So there will be more guidance on that, but it's more now about wearing it and taking it off, as opposed to maybe in the past where it was about not wearing it and putting it on. So it's just flipped a little bit with these new variants and public health. When she said that to me, she said it's in the context of these large outbreaks. And I suppose Mary gave a very good example there of a success story, but we don't know what variant that was in that room. So that's one of the big messages this evening. The other point she made to me was minimizing mixing. Minimize it. Just think about it all the time. Talk to your team tomorrow, wherever the staff are. Keep them separate, as much as possible. And we know it's not easy because you have a business to run as well. But minimizing. And she said, children, this thing has cropped up again about after school children now that we have more schools reopening now. With this new variant, if at all possible, just keep schools separate. And I said, well, that's not easy because you're trying to keep age profiles of children together. But if you have 3 or 4 children coming from different schools, just think about it and think what's feasible and think what's practical for your business. So minimizing mixing is critical. And then the rules of COVID have not changed on this score since the very beginning. The 3 rules around hand washing, respiratory etiquette and physical distancing. They were the rules that came out last year, and they still hold firm. So again, just reiterating that message. And she said, you know, there will be more from public health. I can see some of the comments have come in there about, can Tusla not tell parents this message around symptomatic children, because it's very difficult for you when you're running a business. But there is a lot of messaging going out from public health and HSE colleagues around this, and we meet them every fortnight, and we'll be saying the same thing, that we can step up that messaging to parents, and through parents' means as well. If they can do that, we'll certainly encourage it as much as possible, around keeping symptomatic children at home. So for sure, we all have a role to play in this, and we're working closely with the HSE on all of the messaging around early years services. So Mary, I suppose, introduced the concept of do what you have to do and do it well. And I really liked it when she said it during the week. We came together just to see what way we would message you know, the talk this evening. And I think it's so true. It's like, no matter what business you're in, if you have to put controls in place, like, keep it simple, you know, keep it so that make sure it makes sense, make sure staff understand it. And that's it. There's no need for very extravagant systems. This is about infection control, you know, so, you know, we go back to our old grandmothers' lessons really around infection control, and that should work, you know. But I mean, no, it's not that simple, but do what you have to do and do it well. So, you know, think about, I suppose, all of what we've said this evening. We appreciate the efforts you are making, and we'll work with our staff over the next number of months to make sure that, you know, we can continue together working with you, cognizant of the fact that we have a job to do as well, where things do go wrong in services, you know. So thank you very much. I'm going to go back over to Grant and turn off the screen here, and we'll take a few questions. Conscious as well of people's time, so people may want to leave, but we'll certainly stay for some questions and see if we can answer them. Grant, I haven't been able to see them, so maybe I'll just ask you to as we go through a few of them there.
Yeah, certainly. We've had quite a lot of questions in. I don't think we'll be able to get to all of them before we finish at 8:30. But as we said earlier on, we have got them all, and we will look at how we can respond to them and put them into a document format if we need to. I might just mute everybody except myself there for a moment, again, because I can hear a bit of the.
Is your starter like pullback? Yeah, really. I can't give away the team.
There we go. Okay, I hope you can all hear me. I'm just looking through the questions that I've sort of roughly grouped them into 4 categories. Around cleaning, there's a number of questions around that, around pods and how pods can be managed, around masks and the do's and don'ts around masks, and then a couple of questions about vaccinations for staff. But if we start with a couple on cleaning, any advice for services on how staff manage cleaning with services under pressure for children to attend their correct times for compliance reasons? This can be difficult to manage, and that actually encapsulates quite a lot of other questions that were asked in relation to the challenges for cleaning. Yes, Breda, sorry.
I'll deal with 2 of those. I'll deal with the pods and the cleaning, because they're kind of interlinked, some of them as well. So the pods, I suppose, and there's been a lot of talk about pods, and you look at the public health guidance, it says to form children and form pods in service to limit the spread where possible. Okay, so, and this is a kind of a little grey area as well. So you kind of have to look at your own service in terms of, if COVID came into your service, how far can it spread in your service? So that's what you really have to think about in terms of pods. So there's questions there about, can staff work in 2 pods? How often can I reform my pods? Can I change pods after 48 hours? And I suppose if you look at, if you have an asymptomatic staff or an asymptomatic child and you change that pod, you've potentially infected 2 pods. So you've got to keep that in mind when you're talking about changing your pods. Yes, you can change your pod, but the potential is that if you have an asymptomatic adult or child, you can end up, if you have a case in your service, take out 2 pods for 2 weeks out of your service. So when you're talking about staff and grouping staff together and pods, I know it's extremely difficult for cover in rooms and taking staff from rooms and cross cover within your service. As far as possible, you should try and limit those pods again. So if you get one pod to cross cover with the other, only ye can decide this as managers and as owners, that you can sit down and look, where is the minimum amount of interaction between pods in my service? Okay, if I have to get staff from one pod to cover another, but at least it'll only take out those 2 pods if I've COVID come in through my door in my service. So you'll always have to think about how I can possibly limit this within the pods in the service. You got to think, if I've staff that travel to work together, should I have those 2 staff working together? If staff socialise together, even though there's supposed to be no socialising, but you know that they are, do I need to think about grouping those in the service together? If the last thing you want, if COVID comes into your service, is a full service shutdown, and public health asks all the hard questions when you have a case. They ask, who was that staff in contact with, or who was that child in contact with? So that's where your mixing of pods come in. Okay, that other child went in, these pods mixed here, or this staff mixed there. So that's not 1 pod, it's 2 pods, it's 3 pods. So that's where it expands out in the service. So we can't tell you exactly what to do, because that's determined by yourself and your service, with your own resources, your own staffing, your cover and all of that. But the best that you can do is minimise the crossover between pods and between staff and children, and work that as best you can. It might end up that you have 2 pods crossing over. It might end up you have 3 pods crossing over, which is not ideal. But that's, I suppose, the best thing about pods. Can you change pods? Yes, you can change pods, but you got to bear in mind, when you change those pods, you have a period of about 14 days, 10 to 14 days there, whereas the potential that if you have an asymptomatic case, you could end up taking those 2 pods, closing them down in the service if you have a positive case in your service. A good time is if you're closed for 2 weeks over Easter, sessional services, you could potentially then, because there's been nobody in your service for 2 weeks, to change the pod structure after those 2 weeks. It's an ideal time to do that, because you have that break there. There's a lot of talk then about the masks and the mask wearing. And I suppose the guidance has changed because public health, and as COVID goes along, we've learned more and more about this virus. And we've learned now that it is nearly more transmissible in the air than it is on surfaces. So they're saying it's all about the airborne. So they're concentrating now on masks and ventilation. The cleaning of the surface is still important, because if you cough, you breathe, you're touching surfaces. So the cleaning, what cleaning is required? This has been a few questions that's come up there. Enhanced cleaning measures, and we've given good guidance in our own checklists on the First 5 website and our own Tusla website to enhance, step up your cleaning. And we're just giving prompts there, things you mightn't have thought of before about cleaning, to actually trigger those in your mind, include them in your cleaning schedules. Is there deep cleaning required? We all associate with deep cleaning when you've had an outbreak of an infectious disease. So deep cleaning in that terms to me means a thorough deep cleaning of the service. It's not required unless you've had a case of COVID in your service. You just do your regular cleaning, which is stepped up in light of COVID, in light with our guidance that we've given on our website. If you check the guidance on our website, on the Tusla website in the First 5, it gives very good detail there on stepping up that cleaning. It is very difficult, and I totally appreciate it. You're paid usually on the schemes for contact time, so it is very difficult to incorporate cleaning. You're not paid extra for doing that, but really that's not within our remit. You're going to have to, I suppose, manage that yourself, and how you manage your own cleaning within the service. The mask wearing and the cleaning. So the mask wearing is the other thing. There's a few questions there about when to wear a mask, how to wear a mask. So now I was mentioning there about the change in what we know about the virus, that it is now more airborne. So that's where public health, only in the last, I'd say, month to 6 weeks, have been really talking about mask wearing in services. Because back last year, the beginning of the pandemic, and when service was opening in September, June, there wasn't much talk about mask wearing. And now the message is, where possible. Again, it's a little bit like the pod. You're going to have to sit down and think, where possible, where reasonable, where practical in your service can staff wear masks. They definitely should be wearing it where they're walking in corridors, where they're walking between rooms, when they're doing paperwork, when they're going to breaks or coming from breaks or anything like that. There should be no staff walking around services without a mask. What public health is telling us recently is that a mask should be worn at all times, except for those intimate care moments or those intimate care times with children. So we totally understand. They're young children, there's babies, there's toddlers, very young children, and children with additional needs. there is times when mask wearing is not possible, not appropriate and not feasible, and that's totally accepted. But where possible, where it can be, and you are again the experts in this area, only ye can assess this, of where it is possible, practical, acceptable, feasible, masks should be worn, because that is what will actually protect you if a positive case comes across your door and comes into your service.
Thanks, Breda. That's very useful. Yeah. So you can see there's the kind of consistent message really about, you know, thinking about your service, thinking about how it works, how it doesn't work. Each service is unique, you know, so you really, it is, and like you have to review it, you know, because staff change, you know, if someone goes out sick for whatever reason, COVID or otherwise, you know, you have to think about it again in terms of your pods. So certainly keep thinking about it, keep reviewing it with your management. Or if there's only a small number of you, that just get the team together and start thinking about it. Are there vaccination questions, Grant?
Yeah, just a couple of people asking about their own vaccinations for members of staff in early years services. I mean, I don't think there's much we can say about that, but yeah, there's 2 or 3 people asking about that island.
Yeah, I mean, I know Early Childhood Ireland are liaising with the government, and we can see it in the media all the time about lobby groups looking for vaccination of early years workers, but that isn't for us. That's for the HSE and for the Department of Health to decide on the priorities for vaccinations. So while we've a certain level of sympathy for you, it isn't one we can unfortunately answer. So any other questions, themes, Grant, or anything else coming out there, Elaine?
No, those I think.
Yeah, I think to be fair, it was. Sorry, yeah, I think it was covered really well there. And I think another thing that came, there was a question there about vulnerable children and wearing the mask. So I think again, to be fair, that just highlighted there by Breda that absolutely we totally appreciate circumstances where it's not appropriate, and obviously children with learning difficulties or with speech and language difficulties, they're going to need you know, obviously to communicate in their daily living skills. But I think again there is going to be further advice issuing in relation to that. But I suppose again it's just that it has been really now underlined and really coming to the fore more and more as an output from the outbreaks of the mask wearing. And again, as I said, there are the individual differences between all of your services, and while you may think that we can be prescriptive in relation to that, it's coming back to what Breda and Eileen said as well. It's your individual service, your own review really, and assessing those areas of where you need. Again, I suppose just referencing the deep clean, somebody was talking about doing that at the weekends. I mean, it's again, I suppose it was just what Mary was highlighting again, sometimes the build up of residue on some of the surfaces that can happen both indoor and outdoor. And I suppose in terms of that, of just noting that it doesn't become a risk for you in terms of slipping or falling in your outdoor area, and the same in the indoor. So it was, I suppose, deep clean, as I say, Mary, just a scrub in terms of that in relation to just being aware of these things. I suppose in terms of us today, we were just trying to impart knowledge that we have gained from our communication and constant interaction with public health, and trying to impart that knowledge and give that guidance there to you, that you can look at your own service and go away tonight and saying, I'm going to have a look at my staff, my pods, my mask wearing. Is there anything I can review? Am I doing enough? Am I doing too much? Or, you know, in terms of all of what Mary had said there too about maybe sometimes there, as you have the numbers of children are increasing within your service, that obviously in relation to hand sanitizing and hand washing. So again, to make sure that one is done well. So I think it's important to take that and to review your own service after this in light of it. Obviously, if you have individual questions for your different areas, the structure is there to put in a question there, but I suppose we will take everything else tonight. But I suppose it is just reviewing your own service in light of what we've spoken about. Yeah.
Okay, thanks, Elaine. I think, Grant, we'll call it there. It's getting late. I can see some people are already leaving. Everyone has another day's work to do tomorrow. So thank you, Grant, for looking after us this evening there on the technology front, and to the team, to Mary, Stella, Elaine, and Breda. Thanks for putting the presentations together and for coming along tonight. And to all of you, no doubt you'll be seeing more of us over the coming weeks. I think, Grant, we're back again next week with our final spring series webinar. So some of you may be on. I hope you all found it informative. We'll all have to stay with COVID for another little while. You know, look at our websites. We'll be updating you if there are other changes. Various letters will issue out from myself or some of the team. And so stay safe, and thank you for coming this evening. Thank you.
Great. Thanks all. Thank you.
So.
Thank you. Bye bye all.
Great. Thank you.